This intravenous solution, containing sulbactam and durlobactam, is used to treat specific bacterial infections. Sulbactam is an antibiotic that stops the growth of bacteria, while durlobactam is an enzyme inhibitor that helps sulbactam work more effectively. It's important to note that this solution is only effective against bacterial infections and will not work for viral infections like the common cold or flu. Using this medication when it's not needed can reduce its effectiveness for future infections. The daily dosage and optimal timing for taking this solution should be determined by a healthcare professional. When using sulbactam 1 Gram-Durlobactam gram, 0.5x2, intravenous solution, it is important to follow your doctor's instructions. Typically, this medication is given through a vein every 6 hours, and it should be injected slowly over 3 hours. The dosage and duration of treatment will depend on your specific medical condition and how you respond to the treatment. If you are using this medication at home, it's crucial to learn the preparation and usage instructions from your healthcare professional. Be sure to check for any particles or discoloration in the liquid before using it, and learn how to store and discard medical supplies safely. For the best results, it's important to use this antibiotic at the same times every day. This will help you remember and ensure that you are getting the full benefit of the medication. It's important to continue using this medication until you have finished the full prescribed amount, even if your symptoms improve before then. Stopping the medication too early could result in the infection coming back. If your condition doesn't improve or gets worse, be sure to contact your doctor to discuss your symptoms. Some people may experience diarrhea while using sulbactam 1 Gram-Durlobactam gram, 0.5x2, intravenous solution. If this side effect persists or worsens, it's important to let your doctor or pharmacist know as soon as possible. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. However, it's essential to inform your doctor immediately if you experience any of the following serious side effects: muscle cramps, irregular or fast heartbeat, signs of anemia, such as unusual tiredness, pale skin, rapid breathing, or signs of liver disease, such as nausea or vomiting that doesn't stop, loss of appetite, yellowing of the eyes or skin, dark urine. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. If you develop symptoms such as persistent diarrhea, abdominal or stomach pain/cramping, or blood/mucus in your stool, it's important to contact your doctor right away. It's also possible for this medication to cause oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, changes in vaginal discharge, or any other new symptoms. While a serious allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, be sure to contact your doctor or pharmacist for further guidance. Before using this medication, make sure to inform your doctor about any allergies you may have to sulbactam, durlobactam, penicillins, cephalosporins, or other beta-lactam antibiotics. Also, let them know about any other allergies you have, as this product may contain inactive ingredients that could cause allergic reactions. It's important to discuss your medical history, especially if you have kidney disease. Durlobactam/sulbactam may affect the effectiveness of live bacterial vaccines, such as the typhoid vaccine, so be sure to let your healthcare professional know if you are using this medication before getting any immunizations or vaccinations. If you are planning to have surgery, inform your doctor or dentist about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used if clearly needed. It's important to discuss the risks and benefits with your doctor. Sulbactam passes into breast milk, and it's unknown if durlobactam passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking sulbactam 1 Gram-Durlobactam gram, 0.5x2, intravenous solution. These interactions could affect how the medication works or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial to follow your doctor's guidance and not make any changes to your medication dosage without their approval. If someone takes too much of this medication and experiences severe symptoms like fainting or difficulty breathing, they should immediately call 911 or their local poison control center for assistance. Signs of an overdose can include seizures. Remember, it's important not to share this medication with others. Your doctor has prescribed this medication specifically for your current condition, so don't use it later for another infection unless your doctor instructs you to do so. While you're using this medication, your doctor may want to perform lab and/or medical tests, such as checking your kidney and liver function, or doing a complete blood count. It's important to attend all of your medical and lab appointments. If you have any questions about these tests, be sure to consult your doctor for more details. Make sure to take each dose of this medication as directed. If you happen to miss a dose, consult with your doctor or pharmacist to create a new dosing schedule. Avoid taking a double dose to make up for the missed one. Be sure to follow the storage instructions provided with the product and consult your pharmacist if you have any questions. Keep all medications out of reach of children and pets. Do not dispose of medications in the toilet or drain unless specifically directed to do so. Properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.